Medieval medicine is often remembered for its strangeness, its superstition, and its apparent brutality. But to understand it fully, we have to step into a world very different from our own, one where the boundaries between science, religion, and philosophy were still being drawn, and where illness was not just a biological event, but a spiritual and cosmic one. In medieval Europe, from roughly the 5th to the 15th century, medical knowledge was shaped primarily by ancient Greek and Roman texts, particularly the works of Hippocrates and Galen. These sources introduced the theory of the four humors: blood, phlegm, yellow bile, and black bile. Health was thought to depend on the balance of these fluids within the body. Illness, therefore, was understood as an imbalance, something that needed to be corrected, not through targeting pathogens, but by adjusting the body's internal environment. This led to treatments that today seem crude, even dangerous. One of the most common was bloodletting, used to remove what was believed to be excess blood and restore humoral balance. Patients were bled using knives, leeches, or special mechanical instruments. In many cases, this weakened them further. But the procedure was standard practice, not just among commoners, but among the nobility and even royalty. Other methods included purging through laxatives or emetics, or the use of heat and suction to draw out bad substances via cupping. Though these approaches rarely helped the underlying condition, they were based on a logical framework, one that had dominated Western medicine for over 1,000 years. Diagnosis in the medieval period was also very different from what we know today. One of the most important tools a physician could use was a patient's urine. It was examined closely. Its color, smell, and even taste were analyzed to determine the nature of an illness. This wasn't arbitrary guesswork. Urine analysis had its own complex system of interpretation, codified in texts and taught in universities. Because of the deeply religious worldview of the time, medicine was not purely physical. Disease was often interpreted as a sign of divine punishment, or as a trial sent by God. Treatments, therefore, often included prayer, confession, or pilgrimage, especially in cases where no clear physical cause could be found. Spiritual healing and physical healing were not separate categories. They were intertwined. While physicians existed, access to them was limited. Most people relied on folk healers, monastic infirmaries, or barber surgeons who performed basic procedures such as bloodletting, tooth extraction, or even amputation. Surgery was extremely risky. Without anesthesia or knowledge of germ theory, procedures were painful, dangerous, and often fatal due to infection. Despite this, medieval medical practice was not static or entirely irrational. In monasteries across Europe, monks copied and preserved classical medical texts. Some religious orders maintained herb gardens and developed practical remedies based on centuries of observation. Herbalism flourished, and certain ingredients, such as honey, vinegar, or willow bark, offered genuine therapeutic benefits. But alongside these effective practices existed many that were symbolic or ritualistic, based more on tradition than observation. One of the darkest chapters in medieval medicine came during outbreaks of epidemic disease, most famously the Black Death of the 14th century. With no understanding of bacteria or transmission, explanations ranged from corrupted air to planetary alignment to divine wrath. Some responses were deeply destructive, including the persecution of marginalized groups, such as Jews who were wrongly blamed for spreading the plague. Others were more practical. The word quarantine itself comes from the Italian quaranta giorni, the 40 days ships had to wait before entering port to reduce the spread of disease. It is important to remember that medieval people were not ignorant or foolish. They lived in a world constrained by the limits of their knowledge, and many of their medical practices made sense within the frameworks they had. Moreover, the foundations they laid, through the preservation of texts, the systematization of diagnosis, and the creation of medical institutions, would later form the basis of modern medicine. By the end of the medieval period, change was on the horizon. The Renaissance brought renewed interest in anatomy and empirical observation. Dissections became more common, and medical training slowly began to move away from purely theoretical instruction. But even then, many medieval ideas persisted well into the 17th century. In the end, the story of medieval medicine is not simply one of darkness and superstition. It is a reflection of human effort, of people trying to understand the body and the world with the tools they had. While much of what they believed has been disproven, their struggle to heal, to relieve suffering, and to make sense of illness remains deeply human and not so distant from our own.